This is part 5 of the SI joint pain and hip pain exercises that I will most commonly use when progressing someone through care. Last one is a box squat that I'll progress somebody all the way up into a full standing squat, because functionally you're going to be utilizing a squat during your day, whether it's picking weight up off the ground, standing up out of the chair, or standing up off the toilet. Squats are something that we all use, and that's why it's important to make sure that you've got the strength and stability when you're doing that, so that you don't fall right back into having hip pain or lower back pain. So let's get into it. Typically, when we've gotten to this point, I'll start somebody in a position at chair height to get an idea for what we're dealing with as far as hip activation and core activation. You want to go about feet about shoulder width apart, toes pointed straight forward. You're going to breathe into the core, pressurize down using the abdominal brace, hinge forward from the hips, squeeze the glutes, and stand up. So some of the most common problems we'll see when I progress somebody to this point is either you're not able to recruit the glutes enough to where you're getting that repetitive clicking in the knee, or you're losing control of the core and you're arching your back to overutilize the paraspinals. So a couple of the troubleshoots that I use to get people activating the correct muscles so that we can continue building is, first step is just widening the stance. You want the toes just pointed out slightly, typically about a 45-degree angle. Again, same thing, breathe into that diaphragm, use that abdominal brace, hinge forward at the hips, and stand up. If you're still having problems with that, typically I'll have them cue their legs to keep their knees out over their heels by just gently applying pressure to try and remind their brain to keep those knees out. Same thing. And if they still can't get it, typically we'll either raise the box height or add some assistance with a band, or just make it easier and easier for their bodies to be able to recruit the glute and the core without over-recruiting the quads and the paraspinals, because it's a balancing act. Now, once we get to a point where they can perform it, that's when we'll go to a full-on standing position. Typically, we'll start out about shoulder width apart, a little bit wider, toes pointed outward, squatting down all the way. And once they get past that, toes pointed forward, all the way down into a full squat. And then depending on what they're doing throughout the day, a lot of times I'll add a barbell to add a little bit of weight to it, especially if they do a lot of lifting throughout their day with weight. And then we can add, as much weight as we need to really make it functional, to make sure the problem's taken care of. But that's been, these last 5 videos have been the exercises that I typically use when progressing someone through care for SI joint pain and hip pain. So I'd appreciate like, follow, subscribe, and then come back for more.